Good morning. It's morning where we are. So my name is Mark Hartley. I'm the editor of RDH magazine.
I'm Kevin Henry, and I'm the managing editor of Dental Economics magazine.
We are here to talk about the October issue. We've got a couple stories that we want to talk about this morning. But before we get into that, I want to ask you if you've gotten the September issue of RDH magazine, and I got an invitation from this woman right here, who was the a Sunstar RDH Award of Distinction recipient for her, and she sent me a Facebook invitation. Kevin and I are big heavyweights, I guess you want to call it that, on MySpace.
Huge.
And so this was my fourth Facebook invitation.
Wow.
So I'm really moving there. I've got over 600 friends on MySpace. Kevin's got 100.
I do. Help.
So, anyway, I thought it was interesting that I got a Facebook invitation. So if you're on Facebook, please send me an invitation. And if we're not friends on MySpace, join me there as well. Kevin, it's almost Halloween.
It is almost Halloween.
And did you really have a pumpkin planned out this year?
My daughter has a pumpkin ready. She has her Pirates of the Caribbean carving set ready to go, so we'll be seeing Johnny Depp in no time at all on the pumpkin. Absolutely.
So what do you think about doing for October?
Well,
what's your favorite story, I should say?
Well, that's all right. A couple of things that I wanted to point out for the October issue of Dental Economics. We'll be having our practice survey, and that's always a very well-read issue, and we'll be really looking hard, working with the Levin Group on collections and billings, and also doctor satisfaction. So I think you all will find that very interesting. Speaking of surveys, there was one in the September issue of Dental Economics on fees, and yes, we realized the charts were not in there. However, they are available now online at www.dentaleconomics.com, and you can just follow the links in the resource center, and you'll be able to find the survey. Our intention was to put it up online. We just didn't actually mention that in the book, so our apologies for that, but everything you'll need to know is now available online. And one more issue I want to point out, Mark, in October,
okay,
if you'll let me, that we're going to have a story by Dr. Matthew Brock on the synergy between the GP and the endodontist and how you can build a better working relationship with specialists. So we hope you'll take a look at that, and we hope that you'll let us know what we're doing right and what we're doing wrong.
All right. Well, thanks, Kevin.
Sure.
I have this one was a hard one for me.
Okay.
You know I struggle with hard things.
I do. I understand that completely.
I wanted to talk to you about an article that we have that talks about death. And, October, Halloween, maybe that's something to do with it. But I'm telling you, I had a hard time with it because I normally think about putting death and taxes back behind the classified ads if we can. But I gave a pretty good play to an article written by Noelle Couch in the October issue that's called The Kindness of Strangers. And she talks about dental offices dealing with the sense of bereavement with their patient. And it was very well done. And we all experience loss in our lives. And Noelle talks about losing her best friend to cancer, a woman named Melissa, and how she went to the airport and struggled to deal with her grief that was very profound right there in the airport, and about the kindness of strangers that helped her get through that. And it's a very touchy situation in a dental office when you have a patient that is dealing with grief, and you know that the patient is dealing with grief. Sometimes they want to talk about it, sometimes they don't. So, and she offers some good suggestions on how to approach that very delicate situation. So, anyway, I thought it was a very interesting article, and I hope you take a few minutes to read it yourself when the October issue of RDH comes out. So, I hope you get RDH and enjoy it, and Dental Economics should be out, I would imagine, by...
We're hoping, we hope Halloween.
Halloween. There we go.
How about that?
And happy Halloween to you.
Happy Halloween.
Good night.
Bye.